right. Hello, everyone, and welcome. Thank you so much for joining us today. We're excited to be talking about a topic that we know is top of mind for many of you, and that is how to run a more efficient, high-performing eye care practice. We know that as practices grow, it becomes harder to balance patient volume, staff utilization, and profitability. So, our goal for today is to share practical, real-world insights that you can apply to improve how your practice operates day to day. As a quick introduction, I'm Jessica Marabella, Content Marketing Manager at Carrot, and I will be your moderator. If you're not familiar with us as Carrot, you might remember us as Virtual Field. So today, under our new name of Carrot, we are proud to be a modern eye care diagnostics and workflow platform designed to help practices operate more efficiently. We combine clinically validated testing with automated workflows and actionable insights to help you streamline operations, improve the patient experience, and make more informed business decisions. So, a few logistical notes before we get started. Everyone who registered will receive a copy of the recording after today's session. If you have questions at any point, please submit them through the webinar's Q&A panel. I'll be moderating those throughout and we'll bring as many as we can into the live discussion. And if we don't get to your question, we will certainly follow up afterward. All right, now here is a look at what we'll cover today. First, we are grateful to Dr. Maria Sampalis for pre-recording an exclusive presentation on practice efficiency for us today. Now, I've had the opportunity to review the presentation in advance, so I can tell you that Dr. Sampalis begins by grounding in the reality of running a practice today and discusses why so many teams feel busy but still struggle to grow efficiently. From there, she shares what efficiency actually means in practice. So not just seeing more patients, but how systems, workflows, and team structure all come together. Then Dr. Sampalis will walk through the core areas that really drive efficiency, from technology and staffing to workflow design and clinical strategy. She also covers what tends to be the missing piece for many practices, clear visibility into your practice's operational data and how that impacts performance over time. Dr. Sampalis' presentation wraps up with her thoughts on what high-performing practices are doing differently and how they're using data to make more informed business decisions. So that will be our pre-recorded portion of today's live event. Then I will be turning the virtual mic over to our Director of Product here at Carrot, Charmaine Brown, so you can see how our customers are using our new Carrot Analytics dashboard to turn operational insights into business efficiency strategies. And of course, we'll wrap up with some time for a live Q&A with Charmaine at the end. Okay, so now I'm excited to introduce our speakers. So as I mentioned, we'll hear from Dr. Maria Sampalis in an exclusive recorded session. Dr. Sampalis is the CEO and co-founder of Sampalis Eye Care in Rhode Island. She earned her Doctor of Optometry degree from the New England College of Optometry and holds a Bachelor of Science in Biology from Northeastern University. She lectures nationally on practice management and is widely recognized for her contributions to the field, including being named Rhode Island Young Optometrist of the Year, Most Influential Woman in Optical, a World Council of Optometry Eye Care Hero, and a Women in Optometry Industry Influencer. She brings a strong real-world perspective on what it takes to build and run an efficient, high-performing practice. Then we will be joined live by Charmaine Brown, PhD and Director of Product here at Carrot. Charmaine leads the development of innovative eye care solutions at Carrot, combining clinically validated diagnostics with modern workflows and data-driven insights. She brings over a decade of experience in healthcare technology, including launching more than 14 healthcare startups and working on early AI-driven clinical decision support tools. She holds a PhD in cell and molecular biology from the University of Texas at Austin, where her research focused on developmental neuroscience, and she actively mentors women transitioning into new careers in health and technology. Now, enough from me. It is now my pleasure to share this exclusive presentation Dr. Sampalis recorded for us. I'm going to go ahead and play that now. Please note there might be a brief pause as I get the video started.
Thank you. It's an honor to be here tonight for this presentation, running an efficient, high growth eye care practice. I'm hoping that many of you take some information from this webinar and incorporate it into your practices. Running a practice today is not easy. I think most of us already feel that, right? Especially since COVID. What I see is practices that are working harder than ever and not necessarily growing. The schedule is full, the team is busy, patients are being seen all day, but profitability just isn't there. And because we see more patients doesn't necessarily translate to better performance. Many cases, revenue, staffing, operations, they're just not aligned. And the biggest issue is small insufficiencies that add up over time. A few minutes lost can add up to missed opportunities, breakdown in flow over time, and real impact on growth. If you think about it, you lose $100 a day on a missed opportunity on a follow-up visit, a walk-in exam, even more. Let's make it $200 a day. That's $1,000 a week. That's almost 50 weeks. That really adds up in your practice on something so minimal that makes a big impact. When we talk about efficiency, most people think about speed, seeing more patients, moving faster, filling the schedule, but it's not really what efficiency is. Efficiency is about systems, okay? It's about how well your practice is structured to maximize each patient encounter, use your team effectively, and make better decisions day to day. You can be very busy and not be efficient. The goal is not just to do more, it's things doing better and more consistently. So when I think about efficiency practices, I think about 5 core areas: technology, staff and training, workflow design, clinical and scheduling strategies, and data. If one of these things are off, you really feel it. You'll feel tired at the end of the day. It just won't feel like the patient experience was what it should be. And that's when things are aligned, the practices can really scale over time. Technology should make your life easier. It shouldn't make it harder. But a lot of practice systems don't really work together. You might have an EHR, but you're not doing things like you're supposed to. You're doing things manually. Patient data might not be captured consistently, which makes it harder to follow up and track performance. That is one of the key things in your practice, is to be able to track your data and see how you perform and over time, and what areas you can improve on. Things like recall and follow-ups also depend on staffing to remember to do it, and some staff just forget to do so. The goal is to use technology to reduce friction, to make it more process consistent, and to support better decision making over practice. I mean, the technology everyone can use in their practice, just a recall system with the AHR. Having patients check in before they come into the exam, putting all their data, all their information, all the insurance verification. These are all things that can be done ahead of time to reduce some of that friction at the front desk and errors at the front desk. Cross-training staff. I'm a big advocate for this. I think it's one of the key things in my practice that I've been able to grow. Your team is the biggest driver of efficiency, but practices really everyone has their solo role. People stay in their lane. Everything adds up and just backs up to you as the doctor. You need to be the driver of the practice and not have things slow down because of staff not being trained or cross-trained in that aspect. Cross-train makes a huge difference. When your team understands more of the workflow, they can support each other and keep things moving. It also allows them to identify patients' needs earlier and contribute to a better experience for the patient. So we get better reviews online, less patients in the waiting room, patients complaining that they had to wait too long. And ongoing training is important. It starts at onboarding and it's continuous development. My staff is empowered to to make decisions when I'm not in the exam room. If we are behind and we know we have a glaucoma patient that has a history of glaucoma, they know they can do a visual field beforehand. They can work backwards. They can have them look in the optical. They are empowered to do most of those testing, most of those decisions before I get into the exam room to save time. And it just makes it for a better patient experience as well. Workflow is a lot of inefficiencies showing up. Patients waiting between steps, inconsistent flow, or the doctor doing tasks that could be delegated. A well-designed workflow should feel smooth and predictable. We want clear patient journey from check-in to follow-up. Each step should lead to naturally to the next step, and your team should be able to be aligned around the flow. When this happens, it reduces downtime, improves patient experience, and makes it better use of your patients and your time. My staff knows what the follow-up visit is for a glaucoma check, for a contact lens check. They know what exam room to put them in because we have multiple exam lanes, but they have different equipment in each exam lane. And this helps reduce patient waiting time, but it just makes the workflow design easier. When we have our schedule and a patient has contact lenses and other one's another routine exam, I will go into the exam room and they'll direct me with the contact lens patient first. I will evaluate the contact lenses and then they'll take them out. And by the time I'm done evaluating that, they'll pre-test the other patients already pre-tested in the other room and when dilation starts for that patient, I'll go back into the other room and start the exam. And that's just working well with your team. That's just one thing that works in my practice and how I've liked to incorporate it in my practice. Not all appointments are the same. Your schedule should reflect that. You need to understand what you're seeing. Like we said, a contact lens exam might be scheduled with a follow-up or another exam. Whether it's glaucoma, dry eye, these conditions require different types of visits. A lot of follow-ups are quicker exams. I'll do a lot of glaucoma in my practice, and we prescribe drops, and it's an IOP check. So those are quick visits, and the staff will already have it what the Tmax was, what the drops are, what the pressure is now with the drops, what drops they're taking, and we'll have a follow-up visit scheduled right after the exam. So scheduling is based both on clinical and practice needs, and follow-ups they're booked intentionally for a quicker visit or so. Maybe I might do an IOP check while the tech is starting a complete eye exam in the other room. So just got to figure out what works best for your practice and what your style is. And again, having multiple exam lanes will help with that, but being able to schedule efficiently too, right? So sometimes some doctors will schedule 2 full exams and 2 follow-ups within that hour, or see 2 full exams and 1 follow-up, depending on what they want to do. And the follow-up can be an OCT, visual field, contact lens check, infection check, whatever you want it to be. One of the biggest opportunities I see is building a stronger medical model. If you're only focused on routine exams, you're really limiting your growth, especially on what the future of eye care is, right? It's a lot harder now to capture sales with online, and the medical model is one way to really grow your practice. So incorporating these services like dry eye or other medical care can really see things change in your practice, increase in patient revenue, differentiate your practice, makes patients stay within your practice because of the medical care. They have to see you more often. They value your services, and it's just long-term relationships as well. And you don't have to do everything at once. You can do follow-ups, and you can build slowly, right? Whatever you feel comfortable with. That's how I started, 7 years ago, and I just kind of really built it up slowly and what I got comfortable with. And medical model is something so simple, just using the slit lamp at the beginning. Getting comfortable with billing, documentation, the clinical care, and there's just adding up from that. And then I noticed from data mining in my practice, I see a lot of elderly, and really found an opportunity with retina and glaucoma to incorporate wide range photography, visual fields, OCT in my practice as well. And that's been a big revenue booster. Recently wrote an article in ROB. You could just take a regular refraction lane clinic that was generated 500K, and with a medical model, on $200,000 in revenue just from the other doctor not doing medical model in the practice. And this is something that we're watching: cataracts, dry eye, glaucoma. This is something that we have scope of practice that we can really build over time. And it's been a great revenue booster in the practice, but also for me clinically and career-wise, rewarding to be able to help these patients. This is the piece that I think most practices are missing. You can't improve what you can't measure. A lot of us don't measure these things, right? Um, a lot of decisions are based on how we feel, but we don't have clear data. It's hard to know what's actually working. So what things you need to understand that you should know in your practice, and the EHR will help you with these things. Um, Revenue per patient, capture rate for follow-ups on medical, for glasses. You can incorporate the medical model into your optical. You can make specific recommendations for diseases that will help with eyeglass sales, cataracts, anti-glare coating, macular degeneration, sunglasses, transition lenses, fatigue, blue light, things like that. These are all things that we have to provide to our patients and educate them on quality and why they need these things instead of getting this information online. We also need to track staffing costs. How many patients are we seeing per day? How many staff do we need? And if they're cross-trained, that brings it down a lot. The cost of goods is important in your optical. ROI on technology. What is the cost of the technology? What will it bring into my practice? How will it really impact the performance? When I look to bring in new technology into my practice, I go into my EHR, I see what diagnosis I have. How many do I have? If I had 500 glaucoma suspects in my practice, what do I need to, watch and monitor these patients over time and treat the disease? And what am I getting back from the technology on return on revenue? And it was a big indicator to me. It was a no-brainer to bring in technology like this into my practice. And the other thing too is one of these with the headsets now, which is great, is I can move it anywhere in the practice, right? So if we are behind bottleneck, the patient can do it in the optical, they can do it in the waiting room, they can do it anywhere in the practice. A lot of these practices are small. We are lucky to have 4 exam lanes. We can move people around, but they can do it in the exam lane while they dilate as well. And that's been a big help for me in my practice and working more efficiently, taking up less time too and space. When you track, these metrics, small changes can make a big difference. Improving your team's, communication and identifying these treatment opportunities can increase capture rate significantly. That impacts revenue. Data helps you see these opportunities, and it helps you make better decisions over time. Once you know what your data is, you know what to bring into the practice, and it helps with long-term revenue without really working harder. I see high-performing practices consistently. They track performance regularly, like we do. We have team huddles in the morning. I talk to the staff on how I want certain things done, what patients coming in. We have husband and wife a lot of times coming in together. How do we handle that without backflow? How do we take in walk-ins? How do we see emergency visits? And the staff is trained on these things. They're trained on what they see. They're trained on real insights. We are proactive, and we don't wait for problems to show up. And if we do, we're trained on it. How do we handle this for the next time to be better and identify and work that? The staff knows that, patients, a lot of my patients are Medicare patients. They're retired. Do they really need a 3:30, 4 o'clock appointment? Those are high sought out appointments. Towards the end of the day, patients that are working, patients that it might be at the end of the day more optical related visits, revenue for that, and that's great. A lot of follow-up visits, I tell them it should be in the morning, and emergency visits flashes, floaters right away come in. STI can kind of be booked in throughout the day, things like that. But we much rather get the patient in sooner and they kind of know which slots to do so. And I kind of have it open at the beginning of the morning too. I'll look at the schedule and see what the patient's coming in for to be, okay, this is a slot where we can have an emergency contact lens exam where a patient ran out of contacts, needs an exam. That's also very important too, to kind of, where do we put those patients in? Because those, again, those small revenues add up over time. When all these areas are aligned, we start to see things work differently. Your workflows are smoother, your team is more effective, your decisions are more informative, and the practice becomes easier to manage and grow. Efficiency, not one thing, but it's everything when it works together. If one thing you take away from this, the most effective practices don't guess, they know. They know their patients, they know their operations, they know their team, and they know their numbers. So again, it's very important to know the patient base that you have, the demographics you have, the insurances that you take, what pays, knowing the technology that you have and how to utilize it into the practice, knowing the your team's positives and what they can really benefit, strengths and weaknesses, and being able to cross train them to work together. And then knowing your numbers, again, knowing how many patients you see per day, knowing your revenue, what you can bring in, how each patient encounter can maximize revenue with the medical model is a great way to help grow your practice.
All right. Again, I want to thank Dr. Sampalis for her time pre-recording that message for our live event today. Now, Dr. Sampalis touched on several areas that drive efficiency, but one theme that stands out is the importance of knowing your numbers. And we've often heard from our customers that this is where many practices tend to get stuck. They say the data exists, but it's not always easy to access, to interpret, or actually use it to make decisions. So, what we want to do now is show you how to turn data into business growth levers in your practice group, your health system, using our new Carrot Analytics dashboard. So I'm excited to reintroduce Charmaine Brown, PhD and Director of Product at Carrot, who will walk through what knowing your numbers actually looks like in practice. So I will stop sharing my screen, and Charmaine, the virtual floor is yours.
Awesome. Thanks, Jessica, for that introduction. I'm going to go ahead and start sharing my screen. Awesome. So, again, you heard Dr. Sampalis's fantastic presentation about how to think about efficiency and how to think about ways to improve your practice efficiency overall. And we heard from so many of you that you were struggling to understand sort of how your teams were using our device, but more broadly, how your practices are running and the things that you can do and the ways in which Carrot can help you do them. So I'm going to do a brief kind of overview of this new analytics dashboard. And then we're going to talk about some specific use cases of how you can potentially use some of this data to make decisions about your practice. So here we have the dashboard. So there's a lot of data in here, and again, we're just going to go over it pretty quickly so that we can get into some of those examples and use cases. But here, when you land on the dashboard, you'll see some filters at the top. You can decide what time period you want to see, what interval you want to see. So as an example, right now we're looking at the last 12 months. So we're looking at 1 year's worth of data, and we're looking at it monthly. You can choose to look at it quarterly. If we do that, you can see this graph down here just updated with our quarterly metrics. I'm going to go back to monthly for now. You can also enter a custom range if you want. So, maybe you're not looking at the last 12 months or the last 12 weeks, but you want to look at a specific set of data, maybe January to January. You can do that here just by entering the dates that you're looking for and clicking apply. You can also, if you have a practice where you have multiple locations, you can also look across those locations. So here we're looking by default at all of the locations associated with this organization, but you can, select just one, say, oh, I want to know what's going on at this location, um, and filter the data as you see fit for whatever is most helpful for you. Now, if we get into the actual data a little bit, you can see we have some top line metrics at the top. So total number of visits, total number of tests run, total number of visits, average tests per visit, and average tests per device. We view these as kind of your top line metrics, like the things you see first, the big numbers, but then we want you to be able to kind of drill down into each of those, right? Um, if we look down here at this key metrics trends graph, you can see sort of over time what that looks like. Obviously, you saw me hover over these. On the hover state, it will tell you what each dot means. So here we are looking at total tests. So if I hover over one of these, it tells me how many tests were done in September of 2025, and how that compares to the data point before it. So from August to September, this practice ran 22.5% more tests than they did in August. You can switch up the metrics that are shown here. So right now we're looking at total tests. So that's the number of individual tests that were run. But we can also look at visits. We define a visit as a patient visit. So you might a patient may come in and take, a visual field and a color vision and an EOM. And so that would be 3 individual tests, but 1 visit. So you can do some comparisons. The visits versus the tests will feed into this kind of average tests per visit number, which you can also drill down into. This one you can see isn't changing nearly as much as those others. This practice is pretty consistently running 1.9 tests for every patient that comes in. The average tests per device. And you can also look at new patients. So how many new patients are being tested on your carrot at each time interval. I'm going to come back and sort of explain and do some examples on this data in a few minutes, but for now we'll keep going and show you the rest of this dashboard. So we also have metrics around patient distribution. So in this case, we have the total number of visits. Of those visits, how many of them were unique? So the difference here being, if a patient comes in again, so again, we're looking at 12 months in this use case. So over the last year, there were 4,696 visits, and of those, there were 3,151 unique patients tested on the carrot. And we also show in coordination with that, what percentage were new patients versus established patients. So which of these patients in the last year had been seen before, and which of them are net new. So here we have an 80-20 breakdown. You can also look at, we mentioned before that you can filter by locations, but you can also kind of look at the location metrics side by side to see how they compare across different locations. And then as we keep going, we have some metrics around test analysis. So this is showing both test volume over here on the left and visit penetration on the right. So test volume, again, our definition of a test is a single test, not a full suite of tests, which would encompass an exam or a visit. So here we're showing that there were, 8,900 tests run. And here's the breakdown. You can see that this practice is doing mostly visual field screenings and pupillometers. If we look at visit penetration, there were, 8,900 tests run. Those tests were run at 4,600 visits. So again, that makes sense, right? This practice is on average running almost 2 tests per visit within their carrot device. And again, you can see the breakdown of the visits. So, the pupillometer is done at 97% of visits, whereas a visual field screener is done at 90% of those visits. You can also cut this data by visual field patterns. So if you're doing a lot of visual fields, you can look at what patterns are being done. So, here they're running a lot of screeners, right? So they're running the nasal 30, but you can see that they're also running some 24-2s, 10-2s, 30-2s, etc. You can, in addition, cut the data based on patient type. So right now we're looking at all patients, but you can filter it for new or established patients as well. And then finally, daily usage patterns. So this shows you the average volume of tests that are done on each day. So here there were 2,000 tests done on Mondays in the last 12 months, but the average daily volume on Mondays is 40 tests. And you can see that this practice is doing most of their testing on Monday, Wednesday, Friday, with lower numbers on Tuesday and Thursday, and the lowest on Saturday. Okay, so I know that was just a lot of, hey, look here, look what we have. Um, but I also promised you some examples and some stories, and I think those are definitely more interesting. So let's get into those. All right, I'm going to scroll back up to the top. And you may have noticed that these numbers up here, these trends look pretty good, right? The total number of tests is up by 5% over last year. The total visits is up. They're now doing more tests per visit than they were last year. All of that is great. But you see this number over here that says that average tests per device is down, and down pretty significantly, right? So you may have been wondering, what's that all about? Um, and so I want to tell you a little bit of what's happening here. So if we come down and look at the average tests per device, you can see exactly where it dropped, right? So we went from July of 25, where there was 450 tests per device in that month. And then you can see it drop significantly in August. Now, if we look at the total tests, you can see that if you look at July, there were so many tests run in July. They were running tests like nobody's business. So they ran 43% more tests in July than they ran in June. So what happened here was this practice was growing, right? And they saw that they were running more tests. They had more patients coming in, and they started to run into bottlenecks. So you heard Dr. Sampalis talk about, some of those informed operational decisions. Well, this practice saw that they were starting to run into some bottlenecks with testing. And we see this a lot more with folks who are using the Humphrey versus the Carrot. But it can happen if your volumes are so high, it can happen even with a device that is so flexible and so fast. So, they started seeing some some bottlenecks. It was causing them to slow down a little bit, and they couldn't maximize the number of patients that they were seeing. So when they had this huge increase in the number of tests and the number of patients that they were seeing, they ordered another carrot. And so if we look back at the average tests per device, you can see that, it's climbing. It went up, this huge chunk. And then they purchased a new device, and you can see it levels back out again to about their average. So, um, so this is all to say that, when you see a bottleneck in your practice, there are ways to overcome that. And sometimes it's, changing the way that you are moving patients through your practice. Sometimes it's in scheduling. And in this case, it was adding an additional device so that they could get additional patient throughput. Um, and I think, had they or we been able to really see this data and see these huge jumps, and I'm not showing previous metrics, but they had a few of these really big jumps. I think it becomes really clear where you can see like, wow, that's a lot of tests for one device. Maybe we need another one, right? Okay. So you also heard Dr. Sampalis talk about maximizing patient encounters. I'm going to switch over to a different view. Um, and I want to talk a little bit about different tests that are being run. So, the more tests that you can run on a patient, the higher your efficiency is going to be. And the more that you can do in a single appointment, the better. So, I talk to a lot of customers. I'm obviously not an eye care physician myself. I'm not a clinician. But I talk to a lot of you on a daily basis. And one of the things that we hear a lot is that, especially for new patients, being able to run a broad spectrum of screening tests in that initial visit and just quickly and efficiently getting those tests done is really critical to keep patients moving. So I wanted to show this practice as an example. You can see here that they are running a broad variety of tests, right? Basically everything we can run, they've run. Um, and you can see that they're doing a lot of screeners. So, patient comes in and almost everybody is getting screened, right? The 82% of visits include a visual field screener. But they're doing some other screening type tests as well, right? They're doing color vision, they're doing extraocular motility. And we hear a lot about how important screening is to not just um, improve, patient care, but to catch things early and from a practice management and efficiency standpoint, to increase the likelihood that you can or should be performing a billable test. So a lot of times a patient may come in and not have a complaint. You run some screeners on them and maybe you identify that there is likely some visual field loss. And now you run a 24-2, which is going to be billable at that higher rate. So I think being able to see sort of what is being run, what your options are to run them, and to sort of build out kind of a tool set or a playbook for how to perform some of this testing is really interesting and really makes a difference in the efficiency of your practices. I also wanted to touch on just fairly briefly about the intentional scheduling. You heard Dr. Sampalis also talk about intentionally scheduling. Not all appointments are created the same, right? And so I was just talking a lot about screening versus, maybe a more extensive visual field. And so I wanted to, again, use this example where, we think about a new patient visit maybe versus an established patient visit. So if we look at the data, this practice, you can see we're looking at all patients. This practice is running a lot of screeners, just kind of overall. Um, But if we look at the new patients, you can see that right now with all patients filtered, we have visual field screeners, then thresholds, then pupillometer. Now, if you look at that same order, when I go to new patients, that flips, right? We have even a higher percentage of tests are screeners. The pupillometer is now number two and color vision is number three. And not very many new patients are getting visual field thresholds, right? These are probably patients who were referred a specific uh, for a specific issue. But you can see that it really changed the practice pattern, right? Whether it was a new patient or an existing patient. If we look at the established patients, well, now they're probably not doing any of these other tests, right? These patients are established. You know what they're there for. You know what happened last year and you know what they need this year, right? When they come in for their visit. So, maybe they were pretty healthy last year and you're just going to run a quick screen, or maybe they need more extensive testing and they're on a, quarterly, 6 month or yearly schedule to get their visual field threshold done. So all of that is to say that I think when you look at these different tests and these practice patterns within your practice, especially practices that have multiple locations and multiple physicians that are ordering tests and running tests, um, the time difference for you to run a visual field threshold for your patient is going to be pretty different than if you have a new patient coming in and you're running all of these screening tests, right? So how you schedule them, when you schedule them, may be, completely different. And the time that you allot for those different types of tests is also really important. So what our goal as Carrot and with this dashboard, our goal is to provide you with all of the data that you need to help you make some of these decisions. So you can see what tests are being run when a new patient comes in versus an established patient. So you can see what your test volumes look like and if they're up or if they're down. So you can see what percentage of your patients are new versus established. So you can see all of these things and get a better understanding of what's happening in your practice so you can make some of those decisions that Dr. Sampalis was talking about. And with that, I'm going to stop sharing my screen and I'll pass it back to Jessica.
Thank you so much for that. Thank you, Charmaine. I'm going to take control of the screen back, share my screen. So if you would like to know more about the Carrot Analytics dashboard, you can go ahead and scan that QR code that you see on the screen. I'm also launching a quick poll here. If you would like to speak with a member of our team about the dashboard or anything related to the Carrot diagnostic system and would like a custom demonstration, just let us know by answering yes to that poll question. Otherwise, we do have one question I would love to sneak in here before we have to wrap up. Um, so, um, so Charmaine, the question is, for groups with multiple locations, how does the new Carrot Analytics dashboard help them operate more like a system instead of individual clinics?
That is a great question. And I think that's one of the places where this dashboard really shines. So, I just talked pretty at length about the different tests that you can run and the different practice patterns, whether you're running screeners or pupillometers or, TOSIX exams, right? One of the things that I think this is really great at is comparing across locations. So what is happening at one location versus the other? And you can see, especially as an administrator or a practice manager that's overseeing several different practices, you can see very easily and quickly with our dashboard what tests are being used and when at your different locations. So, we've had quite a few customers, larger customers with multiple locations who will start thinking about, formulating, playbooks of sorts, right? Where they'll say, okay, when a new patient comes in, this is how I want us all to practice. And you can see whether or not that is happening at your practices today. You can see, you know, help you make some of those decisions about where you should be, where you are spending your time, what tests you are running. So I really think that those cross location metrics are going to be super valuable if you're trying to sort of set practice patterns across your organization.
Awesome. Thank you. Thank you so much for that. And we are out of time. So I want to again thank Dr. Sampalis. Thank you, Charmaine. Thank you to everyone who joined us today, or thank you if you're watching this as the recorded presentation. And lastly, as we always say to all of the vision care heroes who are helping provide exceptional eye exam experiences to their patients every single day, thank you for everything that you do. So until next time, take care of yourselves. Bye, everyone.